Watching a Youth TV, empowering you.
The 26th of September in 2007, the World Contraception Day was initiated, and ever since then, the celebrations have continued with an aim to improve awareness about the available contraceptive methods to enable young people make informed decisions of their sexual health. This year, the MAST Students Guild, through its Ministries of Health and that of Gender and Guidance, have decided to join the awareness. We are going to talk to Dr. Rogers Kajabwangu, who is a gynecologist at Mbara Regional Referral Hospital and also a senior lecturer at Mbara University in the Department of Obstetrics and Gynecology. Good afternoon, Dr. Kajabwangu.
Yes, good afternoon, Maureen.
I had introduced you earlier, but I would like to know more about who you are and what you do.
Yes, my name is Rogers Kajabwangu. I am a gynecologist here in Mbara. I work with the Regional Referral Hospital, and part of my work is to treat women, but also teach the medical students that come to the ward.
Yeah, so now on the 26th of September, it's going to be the World Contraception Day.
Yes.
We would like to know what contraception means.
So contraception is, in simple terms, preventing pregnancy, preventing conception, which is the first step in a pregnancy. Yes.
Okay. So what are those methods that are available that the young people out there could be aware of and can use to prevent pregnancy?
There are a number of methods, and we generally group them into artificial and natural methods.
Please understand contraception and family planning. What's the difference between contraception and family planning?
So let me start with family planning. Family planning has three concepts, and one is to plan the family size, where a family decides and says, we are going to have this number of children. The second concept is spacing, where the births are spaced to ensure optimum benefit for the mother, the forthcoming baby, and the babies who are already there. And then the third concept is stopping, knowing that we've had the number of children we wanted to have, and now we are going to stop. So those are the three aspects of family planning. And contraception, which in simple terms is preventing conception, is a means of family planning. It is a means to achieve family planning. So that's how I would simply put it. Yes.
In other words, family planning is the bigger picture, while contraception is part of family planning.
Yes, sure.
So what are the different methods of contraception or contraceptive methods available?
Yes, we have both natural and artificial family planning methods. So most of the methods we see are artificial, but there are a few natural methods which are really based on the menstrual cycle of a woman. We know that at the very beginning of the cycle, a woman is you could say infertile, and then there is a fertile period that follows, and then towards the end of the cycle you have a time when she is infertile again. So the natural family planning methods are based on that kind of timing, that there is a period in a month when a woman cannot conceive even if she had unprotected sex. So they include methods really that are aimed at timing ovulation, methods that look at the symptoms of ovulation, where a woman can see, for example, an increase in the cervical secretions and knows that now I'm fertile. She can see her temperature changing if she measures it religiously, and sees that now she's becoming fertile. Or she can just really calculate on a calendar and say, according to my cycle, most likely on these days, I will be fertile, and these days I will not be fertile. That is how methods like the moon beads come about, and the calendar-based methods. So that's mostly about natural contraception methods. Yes.
Okay.
Yes.
We hear about safe days. Safe days, how effective is that method? Is it very effective?
So safe days now is what I've been talking about. When the safe days are those days of the cycle when we think that the woman is not likely to conceive even if she has unprotected sex. And for a woman who has a regular cycle, you know that a number of our women cycles which are not regular. Today the duration, this month the duration is 26, the next time it is 30, the other time it is 32. It's difficult for those women to use that kind of that kind of method. But for a woman who has a regular cycle, safe days can be used effectively to prevent conception. And again, it's about counting the days and knowing that ovulation takes place at around the 14th day. So avoiding sex a few days before and a few days after the 14th day helps the woman not to conceive, by knowing that the days on the other side and the days on the side before are safe. Yes.
Other than safe days, are there any other natural methods that can be used to prevent pregnancy?
Yes, there are a number of other methods. One is, we call it lactational amenorrhea, where a woman who has just delivered within the past 6 months cannot conceive, particularly when she is breastfeeding exclusively. So that method is really about exclusive breastfeeding, and also having not resumed menses. When menses come, the method can no longer work. Yes, so that is the other method. When you say safe days, you encompass a lot of things, including the use of ovulation signs, and also the use of moon beads, which really just time. Yes.
So, other than the natural methods,
Yes.
tell us about the artificial, because they are the ones that are usually used.
Yes. So again, for the artificial, we have those that are permanent and those that are temporary. We have a few permanent methods, specifically 2 of them. One for women, which is the bilateral tubal ligation, where the fallopian tubes of a woman are tied off, and so that means that the sperm cannot move to meet the ovum in the fallopian tube because it's been cut on both sides. That is one of the permanent methods. The other The other, you have a question on
Yeah,
that?
on
Yes,
ovulation.
on bilateral tubal ligation. Yes.
Yeah. What happens if
Someone's tubes.
someone's tubes are permanently cut?
Yeah.
Can that person still ovulate?
Yes, yes. That person can ovulate, but the only difference is that the egg which ovulates will not be able to come down to meet the sperm. So that way she cannot conceive. That person can have her periods normally because the periods come from the body, from the inner layer of the uterus, which is not part of the tubes. So she will still live a normal life of a woman, except that she will not be able to conceive. Yes.
Okay.
Yes.
Tell us about the other permanent method.
Yes. So the other permanent method is vasectomy, where the tubes that move sperm on the genitalia of a man are cut, and also so that means that that person will not have sperm in their semen in the future ejaculations, because the tubes that move the sperm to the rest of the seminal fluid will be cut off, and so that man cannot impregnate a woman because his semen will not have any sperm to do that.
Yeah.
Yes.
Those permanent methods, are there any disadvantages about using those methods?
The disadvantage is that they are permanent. We've had a few people who today feel like they want to not to have any other child, and then in future they desire to have children again. So this is a temporary method. It is almost impossible to correct. So this happens to like women who change marriages. She makes a decision when she's in this marriage, then she gets another man who wants a child, and yet the tubes were already cut. So that is the main disadvantage. The other disadvantage is that they involve surgery. It's really minor surgery, but it is surgery, and well, like any other surgery, it is sometimes complications can happen. The wound that we go through can get infection. This is really very rare, but it can happen. So being surgical is a disadvantage in a way, because the other issue is that you need someone, you need a health professional to do it for you. It's not like the other methods, that some of the methods we are going to talk about will say that the client herself can use the method on her own without needing any help. So in my opinion, those are the fallbacks of the permanent methods.
Does in any way what do you call it, the one where
the vasectomy,
does in any way the vasectomy affect the man's ability to ejaculate?
No, it doesn't. Like I said, there is a tube that moves sperm from the testis of a man to another tube where the semen is. So it is that tube that is cut. The semen will be produced, so the man will be able to ejaculate, but the ejaculated fluid will not have any sperms.
Okay.
Yes.
Now let's talk about the temporary methods.
Yeah. So the temporary methods again have a number of classes. Some work on a very short-term basis, and others work on a longer term. Some are hormonal, and others are non-hormonal. So if we can follow the classification of hormonal versus non, we'll start with the non-hormonal because there are fewer. Actually, at the moment, we only have what we call the copper intrauterine device, or what people call the IUD, which is a coil that is inserted into the uterus of a woman, and it will stay there and prevent first of all the sperm from moving upwards, but also if by any chance the sperm has passed and it fertilizes an ovum, that ovum will not be able to implant in the uterus because the coil is there and it has changed the environment of the uterus, so implantation cannot happen successfully. So that is one, the copper intrauterine device. Then when we go to the hormonal methods, we have the pills. The pills, there are two types of pills. One type has both progesterone and estrogen. Progesterone and estrogen are hormones that the body of a woman produces, and they help the woman to function and to even conceive. So without them, we use, so estrogen and progesterone are produced naturally, but what we do is we give them to a woman every day, and that will change her hormonal profile so that she will not be able to conceive. So there are pills which have both estrogen and progesterone. There are those which have progesterone alone, but they're all taken every day and they prevent the woman from conceiving. Other than the pills, we have the injection. We have two types of injections also. One will protect a woman for 3 months. That is called the Depo-Provera. Then we have another injection called Sayana Press, which will protect the woman for 2 months. So far we've seen pills and injections, but there are also implants. Implants, and a number of them, about three types of implants, and what they all encompass is a small, usually rubber piece, or a number of them are put under the skin, most times of this part of the arm, and then they have hormones which the body will keep releasing slowly to prevent the woman from conceiving. Yes.
Okay, let me take you back. We've had different stories of someone has had an IUD implanted in their uterus, but they end up getting pregnant, or you hear stories of the baby came out with the IUD
in the hand. Yes.
How true is that?
No, that really happens. Every contraception method has what we call a failure rate. It means that this method will not prevent pregnancy 100%. There's a small chance of failure. For example, for the IUD, it's about 0.6%. That's a very small percentage, but it doesn't mean that it doesn't happen. So yes, because the methods are not 100% effective, some women can conceive even with while they are on the methods. Does that mean that we stop using the methods? No. Yes. Are all the other drugs effective? No. 100%? Not really.
Yeah. So as we talk about the pills, we've had different stories of ladies after starting a given contraceptive method, they end up either overbleeding, growing fats in a sense that is very enormous. I don't know if those are some of the side effects of the hormones that the contraceptives contain.
Yes, those are some of the known side effects. Let me just say this: every method of contraception has known side effects. And for pills, really, you're right. Those are some of the side effects: weight gain and abnormal bleeding. But what I want to say is that those side effects do not happen in everyone. Unfortunately, you cannot predict which woman they will happen in and which one they will not happen in. So every method has a side effect, but in my opinion, none of the side effects is as bad as the complications of an unwanted pregnancy. So despite the methods having some side effects, I want to mention that they do not happen in everyone, and even if they happened, they are not as bad as the complications of pregnancy. The other thing is that over time we know how to manage these complications and side effects when they arise. Yes.
So, as you've mentioned, most of the contraceptive methods are usually targeting women. As a scientist, what do you think can be done to improve the methods of contraception? Is there anything that needs to be done or can be done?
That is a good concern. I have had that concern also for some time, because conception involves both a man and a woman. So right now what we need urgently, and I know research is ongoing, are methods which men can also use. The only method right now is for men is vasectomy, which is permanent, and really you don't blame so many men for not utilizing it because it is permanent. But there is ongoing research, for example, devices that can be put at a part of the scrotum, like an implant, the way it is, to prevent conception. Yes.
So now this one goes in as a Christian. We've had different doctrines about contraception.
Yeah.
As a Christian, would you encourage Christians to take on the contraceptive methods?
Yes, of course. As a Christian, I know that the Bible encourages wisdom and planning, and so planning a family should be one of the obvious conclusions we make when the Bible tells us to be wise in all situations. So yes, Christians should plan their families, and they should use contraceptive methods to make sure of that. In fact, I know very many Christians, even in my own family, we use contraception to make sure that we have a family that we plan to have, and our children are spaced, and a family which is healthy, really. Yeah.
Thank you so much. It was good having you here to make us informed about the different contraceptive methods, and also to get to know more about what it means to plan a family. So now that we are in the era of the pandemic COVID-19, we are having different stories of people who are thinking if someone is on a given contraceptive method, they are not supposed to go for a vaccine. Is there any side effects if someone is using a given method? If they get a vaccine, are there any complications they are likely to face?
Well, COVID is a new disease, and the information is evolving, but so far there is no contraindication vaccination in regards to contraception or any contraception method. There has been no study showing that a certain contraceptive method affects the efficiency of the COVID-19 vaccine or the other way around. So I would encourage everyone, including those who are on contraception, to go for the vaccine.
Are there any other contraindicated medicines if someone is to go in for a contraceptive method? Are there other medications that someone is not supposed to take or allowed to take?
Usually we advise women to see a health worker before starting on contraception, because strictly speaking, there are some medical conditions and even some treatments which are not compatible with some of the family planning methods. I should say quickly that there's no condition for which all the family planning contraception methods cannot work. So it's really a matter of the health worker understanding the medical history of the patient and then advising technically on the best method for that patient.
Okay.
Yes.
So as we conclude, what advice would you give the young people out there, especially we see a lot of cases of abortion among university students? Is there advice you would give to the young people?
Well, to the young people, as a Christian doctor, I recommend abstinence. It is a known, well-tested method of not conceiving and ending up with unwanted pregnancies. To the people who are married, we recommend all the other methods. But in general, I would really encourage people to utilize the very many contraceptive methods that are available. Like I said, none of them is without side effects, but the side effects do not happen to everyone. So you cannot sit back and have unwanted pregnancies because you fear the side effects of contraceptive methods. Don't do that. The side effects do not happen in everyone, and even if they did, the medical personnel are trained on how to manage them. But also, the side effects can never be as severe as having an unwanted pregnancy with all its complications.
Okay. So as we conclude, how can people be in position to access these contraceptive methods? Where can they go to access them?
Yes, of recent, the government has been working very hard to increase our contraceptive use rate, and so most of these methods we've talked about are available in most of the public health facilities around. Even the private health facilities, most of them have available the contraceptive methods, and they're only waiting for the users to go and access them.
Okay.
Yeah.
As we conclude, any concluding remarks?
Yes, my concluding word would really be to encourage everyone out there to understand the concept of family planning, so that in future we will have only children who resulted from wanted pregnancy.
Thank you so much, Dr. Rogers Kajabwan, for your time and for the knowledge that you've passed on. I hope the young people out there have been empowered to be in position to make informed choices on their sexual and reproductive health. We hope to contact you in case of any questions, any assistance. We shall be in touch with you too.
Yeah, I'll be happy to do that.
Okay, thank you so much.
You're very welcome.
You're watching a Youth TV, empowering you. You're watching a Youth TV, empowering you.
The 26th of September in 2007, the World Contraception Day was initiated. And ever since then, the celebrations have continued with an aim to improve awareness about the available contraceptive methods to enable young people make informed decisions of their sexual health. This year, the MAST Students Guild, through its ministries of health and that of gender and guidance, have decided to join the awareness. We are going to talk to Dr. Rogers Kajabwangu, who is a gynecologist at Mbara Regional Referral Hospital and also a senior lecturer at Mbara University in the Department of Obstetrics and Gynecology. Good afternoon, Dr. Kajabwangu.
Yes, good afternoon, Maureen.
I had introduced you earlier, but I would like to know more about who you are and what you do.
Yes, my name is Rogers Kajabwangu. I am a gynecologist here in Mbara. I work with the Regional Referral Hospital, and part of my work is to treat women, but also teach the medical students that come to the ward.
Yeah, so now on the 26th of September, it's going to be the World Contraception Day.
Yes.
We would like to know what contraception means.
So contraception is, in simple terms, preventing pregnancy, preventing conception, which is the first step in a pregnancy. Yes.
Okay. So what are those methods that are available that the young people out there could be aware of and can use to prevent pregnancy?
There are a number of methods, and we generally group them into artificial and natural methods.
Misunderstand contraception and family planning. What's the difference between contraception and family planning?
So let me start with family planning. Family planning has three concepts, and one is to plan the family size, where a family decides and says, we are going to have this number of children. The second concept is spacing, where the births are spaced to ensure optimum benefit for the mother, the forthcoming baby, and the babies who are already there. And then the third concept is stopping, knowing that we've had the number of children we wanted to have, and now we are going to stop. So those are the three aspects of family planning. And contraception, which in simple terms is preventing conception, is a means of family planning. It is a means to achieve family planning. So that's how I would simply put it. Yes.
In other words, family planning is